With respect to your further examination of Mr. Larson, did you determine, take us through, was he getting all better? Was there peaks and valleys? What did you see in your evaluation?
Well, I saw him initially, and then I saw him after a long interval, and that was on January 3rd. So when I examined him, I was upset to find that the pain he was experiencing from his toe had worsened, and now he was experiencing the same type of pain in the front of his heel.
Why is that significant?
Because there's a nerve, the tibial nerve goes behind the ankle, and it gives a branch called the medial plantar branch that goes to the big toe, but on its way it leaves a branch to the front of the heel. So it concerned me greatly that he was now having pain from a different area that was worse in nature, and now he had a second area. So my conclusion was that the pain was coming from his brain because of aberrant signals in the nerve. So that I mentioned earlier that when phantom pain comes, when the pain coming from the toe eventually overwhelms the brain, and you begin to have pain from other areas. And this causes the blood supply to shrink down that goes to the foot. So there are catecholamines, like epinephrine, that are released in the area when there's pain that shrink down the blood supply. And the reason this is important, because we know he already had limited blood supply. That concerned me greatly. But I also noticed that his toes were much more curled. They weren't crooked, they were curled. So the curling of the toes is a hammer toe, and that results from too much flexion and no extension. He can't straighten his toes. He can bend them, he can't straighten them. So if that force continues, the toes begin to curl up. And in his case, he had begun to develop a pressure ulcer on one of the knuckles of his second toe. So I was very concerned that in an area of poor blood supply, he was developing an ulcer, which is the gateway for infection.
You said January 3rd of this year.
That's correct, of 2020.
When a patient, well, when Mr. Larson specifically, when he comes in and says, "Doc, I have pain," does he say, "I have pain on the tibial nerve"?
No. He's a man of few words. It's hard to get it out of him. So I had to ask him. He said, "Well, I'm having pain in my foot." "Well, what kind of pain are you having in your foot?" "Well, I'm having it in the toe, and it wakes me up and feels like electric shocks, and I'm also having it in my heel now." Where in your...
Describe as non-responsive.
Sustained.
How did he describe the pain in his own words?
Those are his words. So, yeah.
So did that correlate to your clinical observation that you've given the jury about where the nerves are located in the body and the pain signals that you've described?
Yes, it corresponded to the medial plantar nerve.
Got it. With respect to the hammer toes, I used to believe that hammer toes were just funny looking toes that people were born with. I've learned more about the toe and toes in general from this case. With respect to the hammer toes, is that a medical condition, number one?
Yes.
With respect to the hammer toes, is that something that inserting a prosthetic will help?
Objection lacks foundation.
As a reconstructive surgeon.
Sustained, lay the foundation.
Sure. Have you treated patients with this similar condition by prescribing them prosthetics?
I don't prescribe the prosthetics. If someone in prosthetics would prescribe them that. But I've sent many diabetic patients who have had amputations to the prosthetics lab to have prosthetics made, particularly at the Veterans Hospital.
Would you do the follow-up on them to see, hey, is this working?
Yes.
Okay. Would a prosthetic work in this case?
Well, what does the prosthetic do? I've dealt with this issue many times with diabetic patients who lose toes due to infections and poor micro blood supply. The prosthetic prevents the second toe from curling over into where the first toe was. That's the function of the prosthetic. It does not prevent hammer toe. Hammer toe is an imbalance of the intrinsic muscles, and the muscles that straighten the toe and bend the toe. That's what causes the hammer toe. So a prosthetic cannot fix that. A prosthetic cannot make him lift his toe again. It doesn't happen.
Can it help him push off or walk
The
straight?
prosthetic does not help people push off. And that's very important because when you do an amputation, you need to know what the functional deficit that you're incurring with the patient is. You need your toes to push off. We take it for granted when we're walking. We push off with our toe. That enables us to move forward. Without a toe, number one, we can't push off. Number two, we lose balance.
Given all of the obvious blood supply issue, the obvious medical concerns that you've articulated, why not either start by doing a midfoot amputation or start by doing an above ankle amputation?
Objection compound.
I'll rephrase. Why not start with a midfoot amputation?
Objection lacks foundation.
Well,
Just a minute, please. Overruled, if you can answer.
okay. Well, I've done many amputations myself on diabetic patients. So I know the levels of amputation. I know the functional deficits that result. It's very important before you take someone's foot off that you do it for a very good reason and that you let them know what they're going to be missing when that amputation is done.